Welcome back to Inside Politics. Our guest today is Dr. Alex Jahangir. He's the chair of the Metro Nashville COVID-19 Task Force. We're talking about all the things going on, particularly with the new Omicron variant being talked about spreading across the country. Doctor, just one more question about travel. Should people think about changing their travel plans, particularly airline travel plans, given sort of the uncertainty we've got over the next 2 weeks? If people are going to make changes, they got to make them pretty soon because Christmas is only less than 3 weeks away.
You know, my recommendation for that is no, if you've been vaccinated. Get vaccinated, wear a mask. You know, my family and I have traveled now since my family's been fully vaccinated. I'll wear an N95 mask on the flight. So again, if we follow the precautions we all know about, I don't believe you need to change your plans.
With what's going on, even with the Delta variant continuing here, but now with Omicron as well, is there going to be a greater need for early testing for this? And then will that also mean perhaps more use of these new antibody treatment, antiviral treatment pills that are out there? I know some of them are controversial primarily because they're being given to the unvaccinated rather than to the people who are vaccinated if they get it. So is that going to be more likely to be used, and is it going to help because it's a pill form instead of the shot?
So first of all, I think access to rapid tests are critical. I actually bought 2 boxes at one of the local pharmacies a few days ago when I went there to see my kids get fully vaccinated. The moment you have symptoms, you should get vaccinated, or excuse me, you should get your test, and then you should stay at home if you test positive. Now, it also, knowing that you're ill faster allows you to access the Regeneron, which is the monoclonal antibodies via IV, as well as these pills now from Merck. Those have been shown to lower the severity of this disease. One thing that is still uncertain, but it's really worrisome to some, is with Omicron coming, the monoclonal antibodies and some of these pills won't be as effective against that. So it is really important to get tested, know you're sick faster, get the monoclonal antibodies if need be, and then stay at home.
Do all viruses like COVID-19 mutate this quickly? I mean, we're continuing to have more and more variants coming out.
All viruses want to mutate so that they survive, period. And so when we as a society make it easier for that virus to survive by having unvaccinated people, then yes, that's what we're going to do. And I'm not just referring to vaccinations here in Nashville or Tennessee, the United States, but worldwide, right? So I think part of this, the reason we're starting to see these mutations predominantly in Africa and in India and other places like that, is there was a much higher unvaccinated rate there. So global vaccine access is critical. What we can do here locally is to get vaccinated, because in the United States we're so fortunate and so blessed to live in a country that has more vaccine doses available to us than we have citizens and residents.
So COVID-19 is not smarter than we are, because it seems to be mutating faster in some cases than we're having to react, and we're doing it. But
yeah, I don't think COVID-19 is smarter than us. I think some of us are not being as smart as we should be.
Tennessee is less than 50% fully vaccinated. Some rural counties are still down in the 30th percentile on that. Doesn't that put this state in trouble if for some reason, either because of what's happening this winter, every winter we've had the pandemic, we've had increased cases, or because of the new variant coming in here? Is Tennessee going to be in trouble because our vaccination rate is lower than a lot of other states and below the national average for what the vaccinations are? So
I do worry about our low vaccination rate. Nashville is at 60% fully vaccinated, which is comparable to the national average, and Tennessee's 10 points lower than that. You know, we saw it with Delta. Delta devastated our state. Hospitals were full, lots of lives were ruined. What I don't know yet is all those people who are unvaccinated who got the Delta virus, do they have some level of natural immunity that now will linger and fight against Omicron? I don't know that yet. But again, everyone should get vaccinated, because that is the most effective way to protect yourself.
Two of the most critical tools that this health department has used, and other health departments across the state, particularly in the larger cities, has been masks and a lot more aggressive marketing of vaccines. State legislature changed all that. They've taken a lot of those powers away from you and given them back to themselves, or to the State Department of Health, or to the governor. Are you confident that we're going to be okay with these new laws, or are we going to have a problem if things get worse this winter and we don't have any of these things to fall back on to use as ways to fight the virus?
So I think the best way to deliver public health in a municipality is to have those who know what's going on in that municipality take care of it. So local control is really important. I think there are issues very unique to Nashville and Memphis and some of these larger cities that is not the same as is in Hillsborough, Tennessee, right? We were able to quickly respond to not just this pandemic, but a lot of people forget we had a hepatitis A outbreak before this pandemic. And the local health department would go to nightclubs and vaccinate people at midnight, predominantly gay clubs and as well as other locations. Because that's where we needed at that time. Local entities know where to go, know what to do, and it does trouble me some if those abilities are not able to be accessed.
The governor didn't sign the bill. It went into law anyway without his signature because he has concerns about some of the powers, whether you're still going to have those powers, the health board, in the non-pandemic areas. Are you concerned this bill was so poorly drafted, nobody's quite sure what you can do and not do as a health board? Does the health board still responsibility under the control of the state, or is it still under the control of the mayor and the council?
Well, I'm not an attorney, but my understanding is the Metro Public Health Department is under the direction of the metropolitan government, right? So the mayor, the council, the board of health. We have 700 or so employees, a large budget. We take care of so many important aspects, not just pandemic related, right? From WIC to Ryan White to water safety things. As far as I know, the Metropolitan Health Department is still under the authority of the metropolitan government, and I think that's the right place it should be.
So what does Nashville do if things do get bad again? They're going to look to the health department and the health board and the COVID-19 task force to help because people are getting sick, or there are a lot of cases out there. Maybe we'll see hospitalizations and deaths go back up again, God forbid. Is there anything you can do given the way the state law has been drafted now?
Well, I'll tell you this. I think the Metropolitan Health Department will do what needs to happen to take care of
even if there's
our
questions
residents.
About what you do in terms of its illegality?
Well, I don't think anyone wants to do anything that's illegal, right? But I think what I worry about, here's what I worry about, Pat. We've been able to respond to this pandemic in a very effective way, I think, compared to a lot of other places in the Southeast, frankly, because of the abilities we've had. What I worry about is not just, let's say this virus gets bad in the next few weeks. What about 2 generations from now or 3 generations from now? Something happens and we can't respond as quickly, and people don't have lost the history of how we got there.
Dr. Alex Jahangir is our guest on Inside Politics. He's the chair of the Metro COVID-19 Task Force. We're talking about all the developments going on around the pandemic. Back to continue our conversation on the other side of this break.